like carrying your degrees in nutrition and dietetics. So before I begin, I would just like to give a brief introduction of what I'm going to uh, tell you in this particular session. So, obviously, firstly, what do you mean by nutrition and dietetics? What is the importance? What is the basis? Okay. And the important aspects which are actually related with what you are going to study or what you need to study in the course of your degree, whatever degree you are pursuing. So, starting with, are my slides changing? Please, someone let me know. Okay. Okay, so I will not go for the slideshow part. I will just, I hope it's visible now.
Yes, ma'am, it is visible. Please go ahead.
Yeah, okay. So, starting with good nutrition. So, before talking about good nutrition, I would like to say what is nutrition. Okay. So, nutrition is basically whatever food or whatever nutrients we are consuming, we are ingesting. And the main concept or the main need behind having a proper nutrition or a good nutrition is giving our body the adequate amount of energy that our body demands or requires. Why? In order to carry out the normal functions of the body, and also the physical and the mental functioning of the body at the optimum level. Okay. So that is the main concept behind nutrition. And whenever we are talking about good or optimal nutrition, it means something which will help us in our development and growth and maintenance of the tissues and cells. Now, development and growth is something which is particularly important when we are talking about the children, isn't it? Because the children, they are still in the growth phase, isn't it? They're still growing. They will increase in height, they will increase in weight, the different organs inside their body will also develop, isn't it? So that's why this development and growth part is more important for the children. And then coming to the second point, resisting and fighting infection, that is again something very important, and not only for the children but also for us, for adults also, isn't it? Because resisting and fighting infection means nothing but a strong immune system, isn't it? So in order to boost our immune system, it's very much important to have a proper nutrition. Okay. Next, producing energy, warmth, and movement. Again, energy, which I already mentioned, it's the main reason behind having uh, a proper nutrition. Okay. So moving forward to, I hope the slides are changing.
Yes, madam, it is.
Okay. Okay. So coming to the essential nutrients. Okay. So essential means something which is very important. Okay. So among the essential nutrients, basically we can group nutrients into two categories, macro and micro. So macronutrients are, macro means large, isn't it? So macro is the portion of the food which will form the bulk of our whatever food we are consuming. Okay. So basically in a day we consume three major meals, isn't it? We have breakfast, we have lunch, and then we have dinner. So in all those three major meals, the major nutrients that we consume are in the form of carbohydrates, fats, and proteins. This is something we all know, very basic. And coming to micronutrients, those are, why micro? Because they are required in very small amounts, in very less amount, but they are absolutely necessary. Okay, means it's not that key, since they are required in small amounts, then even if we do not have those micronutrients, we will be okay. No. Okay, so the micronutrients are mainly the vitamins and the minerals, and they are very much important, particularly for boosting our immune system. Okay. And obviously water is there. So nextly, starting with the macronutrients. So as I mentioned, they will include the carbohydrates, the proteins, and the fats. So carbohydrates are basically energy giving foods which are composed of sugars. So carbohydrates are mainly of two types, or sugars, you can also say, are of two types: simple and complex sugars. Okay, so the simple sugars are those which include, white sugar, then the chocolates, the candies, the ice creams. They will consist of the simple sugars, and complex sugars or complex carbohydrates will include rice, wheat, maize, barley. Okay, so the main difference is that we should always prefer complex sugars over simple sugars, because the complex sugars, I will talk about it in details in the upcoming slides about something called glycemic index. So complex sugars actually have a low glycemic index, which is good for our overall well-being. Okay, so, as we know, the common staple food in our country, India, is mostly rice, and in some places it's also roti. Okay, so it will include mainly the cereals. Now, coming to the next category of macronutrients, that is the fats and the oils. So, again, they will be energy giving food. Now, the basic difference between carbohydrate and fat is carbohydrates are uh, uh, both of them will be giving us energy, but carbohydrates will be responsible for giving more amount of energy in comparison to fats. And fats actually uh, do not have that much of importance in our diet, or particularly when we are talking about the different items or the recipes that we have, because fats are mainly responsible for adding taste to our food. Okay, that's why we always prefer outside food, bahar ka khana, restaurants and street food. Why? Because the amount of fats and oils used in such restaurants and street food corners is more, so the food is more palatable. It tastes more better. Okay, but that doesn't mean it's good for our body. I will be coming to that in details. And the last, or but not the least, as we say, are the proteins under the macronutrients. Now, proteins are like whenever we are following a balanced diet, again, I will be talking about balanced diet in details. So, when we will talk about balanced diet, we will see that the major proportion of whatever we are having throughout a day, the major proportion should be of proteins if we want to maintain a healthy weight and a healthy lifestyle. Okay, why? Because proteins are basically the building blocks of our body, we can say. Okay, all the major tissues, the organs, the cells, the major part are the proteins. Okay, 70 to 80% inside our body are protein. So that's why, since they're the building blocks, as they have mentioned, bodybuilding foods, as you can see over here, so they are the major components. Okay, so obviously we should consume them more. Around 70 to 80% of the food should consist of proteins in our diet. And proteins, there are animal sources as well as plant sources, as we all know. And we also know that the plant sources of proteins are limited, and also the amount is less in comparison to animal source. Animal source, there are lots of more varieties, and also the amount is also somewhat more than the plant sources of proteins. Okay, now, coming to the micronutrients. So, the micronutrients can again be of two types, as I mentioned, vitamins and minerals. Now, their major contribution is boosting our immune system, so that our body is more able to resist any kind of infection. Okay, it can be any kind of infection: bacterial, viral, fungal. Okay, anything. Overall, the immune system will be strengthened. Okay, now vitamins, again, I hope we all know that they are of two categories: water soluble and fat soluble. So, what do you mean by water soluble? Water soluble are those vitamins which will be soluble in the water. So, obviously, something which is soluble in water means water is something which is excreted from our body, isn't it? The excess amounts of water, it is excreted via the urine, as we all know. So, along with the water, whatever is soluble in water will also be excreted, isn't it? So, the main difference between water soluble and fat soluble vitamin is that water soluble vitamin will never be toxic in our body. They will never produce toxicity in our body. But the fat soluble vitamins, since they are getting solubilized in the fat, and we all know that fat is something which is deposited inside our body, isn't it? It's continuously getting deposited in our body. So, along with that fat, also, whatever is getting solubilized in the fat, that will also be getting deposited in the fat, isn't it? So, that is something which is harmful, and it can actually lead to toxicity inside our body. Okay, So, fat soluble vitamin, as we know, A, D, E, K, and water soluble will be vitamin B complex and vitamin C. Now, talking about in general about all the different vitamins and minerals, they are majorly present in all kinds of green leafy vegetables and fruits. Okay, and that's why whenever when we were kids also, or whenever we like go to the doctor for any kind of health issues, or say for example we want a diet chart, always you will see that as a dietitian or as a nutritionist, you will always tell your patient to have more and more of green leafy vegetables and fruits. Okay, why? Because that is something which is going to provide you with all the different minerals and vitamins that you require. Okay, so moving forward, again please confirm, is the slide changing? Can you see the minerals wala slide? Okay, I hope it's visible. So again, talking about the minerals are again something having the same function, that is giving us the proper immunity, the resistance power. Okay, and they are also present in the green leafy vegetables and fruits, like zinc, calcium, okay, iron. These are some of the important minerals that we need. Magnesium. Now coming to something called energy requirements. Now, as I already mentioned, ki the main reason or the main concept behind having a proper nutrition is uh, giving the adequate amount of energy that our body requires, isn't it? So the amount of energy will obviously differ from person to person, depending on the age, on the sex, that is the gender of the person, and also what kind of lifestyle that particular person is leading. Okay, so that is exactly what they have said over here. So it's based on the basal metabolism. Basal metabolism is it's coming from the word basic. So depending on the basic body functions. Okay, so obviously a person who is, say, for example, all day sitting at home doing nothing, or just maybe work from home, sitting in the same posture and same position and just doing some work on the laptop or computer, or in comparison to a person who is maybe is a salesperson. Okay, say for example the medical representatives, so their main job is to travel from one place to another and perform their task, isn't it? So obviously that the energy that that particular MR will require is much much more than the energy than that particular person who is doing work from home will require, isn't it? So that is the basic difference. So it will depend on the physical activity and also on the normal physiological processes. Okay, say for example in some cases what happens, the metabolic rate of some people are more, while the metabolic rate of some people is less. Okay, so usually many cases, please, someone's animation is on, please remove that, the animation part. So in some cases what happens, some people maybe they are eating much more, but they never get becoming fat, whereas some people are there, maybe they're eating in moderate amount, or maybe they're eating in less amounts, but still they're getting fat, or they're never being able to reduce the weight, isn't it? So that mainly depends on the metabolic rate. Okay, because in some cases the metabolic rate is more, and in some people the metabolic rate is less. Okay, so more your metabolic rate, more your food will be metabolized at a larger rate. Okay, so now moving on, I hope the slides are changing. Please someone confirm.
Yes, ma'am, it is changing.
Okay, okay. So now coming to dietetics. Okay, so dietetics is basically how you are being able to communicate the importance of having a proper diet or following a proper diet, and how you are being able to make someone's audio is also on. Please mute yourself.
And
Okay, so that is actually what is dietetics. So, as they have said over here, see, eating right is one of the best preventive medicines there. Okay, so as we know that prevention is better than cure, isn't it? So, in order to, and there's also a saying that you are what you eat. So, where like irrespective of our age, irrespective of our gender, irrespective of our profession or not profession, irrespective of our lifestyle, because everyone's of our lifestyle is different from each other, isn't it? So irrespective of that, we should always try to follow a balanced diet, as in always try to follow whatever uh, like whatever we are eating, it should be in moderation. Okay, so it's not that you are only going on eating carbohydrates and no proteins, or maybe you are only eating proteins and no carbohydrates. No, it should not be like that. Okay, so there should be a balance. Everything you should be having in moderation, and that is very important in order to lead a overall healthy lifestyle. Okay, now what will be the role of the nutritionist or dietitian in that case? Someone please remove this animation, it's very disturbing, because there are some people who are like trying to concentrate and listen to whatever I'm saying. Please stop doing this.
Ma'am, I think there are few anonymous people who are doing the annotation,
Okay,
and
anyways, leave it.
I would like to request to the student, because annotation sometimes very important to keep on, because the resource person use annotations to highlight those things, and few students are misusing those things.
Yeah, yeah.
Although I'm removing them from the this group, so please pardon the inconvenience for this. Ma'am, please go ahead. I'll just keep.
Yes, okay. So as the role of a nutritionist or
Ma'am,
dietitian, yeah.
ma'am, do one thing. Do one thing. Please share screen once again.
Okay,
Okay.
okay.
Please reshare your screen once again.
Okay, okay,
I'm
sure, sure.
removing these guys.
Yeah, yeah, sure. Okay, I hope it's visible now.
Yeah, ma'am. It is visible.
Okay, okay. So, coming to the role of the nutritionist and dietitian. So, firstly, you have to monitor, assess, and optimize the nutrition status based on the patient's current medical condition. Now, whenever you are working as a dietitian or a nutritionist, it's very important that you know the proper history of your patient. Okay, history as in medical history. Okay, why medical history? Because depending on what condition the patient is suffering from, or maybe he or she was suffering from a particular condition few years back. Okay, so depending on that, because in many cases, in many chronic diseases, there are some particular food items or some particular food like nutrients that we need to avoid. Okay, or maybe some nutrients which we need to consume more and more. So you need to know in details about the previous medical conditions as well as the current medical conditions of your patient before prescribing the diet. Okay, so after that, confer with physicians to coordinate medical and nutritional needs, because obviously there are some things which the important blood tests or whatever there is which the doctor will prescribe. Okay, so you need to communicate with the doctor also. Make recommendations for tube and intravenous feedings or dietary supplements. Intravenous feedings is it's also known as parenteral feeding. Okay, because in many cases what happens, maybe the oral route, maybe the patient is unconscious, or maybe there's some kind of surgery that has been done in the oral route. So in that case, we need to feed the patient intravenously, which is also known as parenteral feeding. So whenever you are going for IV or parenteral feeding, there are some particular food items which you cannot give to the patient. Okay, so accordingly, you need to make the choices and give the chart. And also you should teach the patients how to make nutritionally sound food choices, because it's very important that just as I said before also, okay, whatever you are eating, you should be very conscious of the food values. Okay, and you should always go or always opt for something which has a high food value. Okay, whatever you are eating, you should be aware about the food value. Okay, so that is it. So moving on. So coming to therapeutic diets, okay. So therapy, we all know what is therapy. So whenever a particular patient has come to you, or and maybe he or she is suffering from some particular chronic disease or chronic condition, any disease condition, then what you need to do is you need to go for a or prescribe a therapeutic diet to that person. Means a diet which is only concerned about treating or giving therapy to that particular person against his or her disease, whatever condition that person is suffering from. Okay. So now there are different types of therapeutic diets. I will be talking about each of them. So regular diet is something which I already talked about and I will talk about in details. That is balanced diet. Okay, that is the regular diet which is applicable for each and every one of us. Okay, irrespective of whether we are having any disease or not. Okay. Then we have liquid diet, soft diet, diabetic diet, calorie control diet, low cholesterol diet. Okay, so I will be talking about them. So starting with liquid diet. So liquid diet, from the name only we can understand ki the diet will be composed of liquid food items. Okay, so anything solid you cannot have. So I have given a diagram which is showing actually what are the do's and don'ts, because liquid means it's not that you will have Coca-Cola and thumbs up, isn't it? So liquid means some those liquid which will be healthy for you, okay, or beneficial for your body. So that is what they have given over here. So it's particularly prescribed obviously for short period of time, because obviously we can understand that the amount of nutrition that you will get from a solid diet is much more or optimum that you will get from a liquid diet, isn't it? But in some cases, in some conditions, you need to go for a liquid diet. Okay. So what are those conditions? Surgery or heart attack. Say for example, you are having an acute digestive problem or infection, acute vomiting or diarrhea. Okay. And also during to perform extras of the digestive tract, because otherwise what will happen if you're having solid diet or the normal diet, then the x-ray will be interrupted. Okay. So next, coming to the next type of therapeutic diet, that is soft diet. So soft diet means basically whatever food you are having, it is requiring less amount of chewing. Okay. And also if it requires less amount of chewing, that means it will be easy to digest, isn't it? So that is basically the soft diet. So obviously easy, like easy to chew or less chewing means obviously it will not include meat, fish or egg, isn't it? So mostly the vegetable sources. Next we have is sodium restricted diet, means diet which is low in sodium. Okay. So that is particularly preferable for those patients who are having maybe hypertension, suffering from hypertension, because sodium means salt, isn't it? The majority of sodium is present in the salt. So you need to have less amount of salt. So particularly when you are having any kind of kidney disease, heart disease, cardiovascular disease, and also high blood pressure or hypertension. Okay. So you need to particularly avoid this pickles, means achar we say, and then smoked meats. Okay. Tandoori kebab, this kind of things you need to avoid. Now coming to something very important, that is diabetic diet. Okay. Now when you will give a diabetic diet, obviously when the patient is suffering from diabetes, isn't it? Now, what is diabetes? Diabetes is mainly of two types. I think most of you know already. So, one is type 1 and another is type 2. Okay. So, type 1 is basically kind of autoimmune, also, you can say, because in type 1, what happens? Uh, the pancreatic cells are damaged because we all know that the main hormone that is responsible for regulating the blood sugar level is insulin, and that insulin is produced from the pancreas, beta cells of islets of Langerhans, which are particular cells located in your pancreas. Okay. Now if you are having an autoimmune condition where the body is I hope you know what is autoimmune. It's the condition, there are different types of autoimmune diseases. So the main concept is a condition where your body's own cells are rejecting your cells. Okay. So basically the body is not being able to recognize what is self and what is non-self, so the body is attacking your own cells only. So that is what is autoimmune. So in case of type 1 diabetes, what's happening? Your body is actually the immune cells of your body will actually go and attack the pancreatic cells, the cells of the pancreas. As a result, they will be destroyed and they will not be able to produce insulin. So type 1 diabetes means there is no insulin in your body, and obviously as a result there is no hormone which will regulate your blood glucose level, so there will be a spike or an increase in the level of your blood glucose. Usually the normal level is around 70 to 110 mg per dl. So if usually we say if it's more than 200, then it's that means that person is suffering from diabetes. And what about type 2 diabetes? Type 2 diabetes is the condition where the insulin level in your blood is normal. Okay, means your body is producing sufficient amount of insulin, but your body or the cells are not being able to recognize that insulin. Okay, so if there is no recognition of the insulin that is produced, then obviously the insulin will not be able to perform its function, isn't it? So even if insulin is present in your body, your blood glucose level will be increased because that insulin is not being able to perform its function. Okay, so that is basically what we say as insulin resistance. Okay, so in both these two types of diabetes, the main problem is your blood glucose level is increased. So obviously, when you are giving a diabetic diet to your patient, to your diabetic patient, obviously you should that diet should not include those substances which will be high in carbohydrate content. Isn't it? Means the sugars, sugar, ice cream, cold drinks, soda, okay, any kind of cake, bakery products. These are all the things, chocolates, sweets. These are all the things that your patient should avoid. Okay, so that is exactly that what they have said over here. Okay, so basically you have to cut on your carbs. Carbs means carbohydrates. Okay, you need to cut on your carbs and you need to consume more and more of proteins and healthy fats. Okay, now coming to high protein diet. I hope the slides are changing properly and my voice is also clear. If there is any problem, please let me know. Okay, and I'm not being
Yeah,
able to
it's
check the chat, so I will check it
clear.
later. Yeah, someone saying something.
Yeah, ma'am, your screen is absolutely fine and your audio is also clear. Please
Okay,
continue.
okay. So high protein diet means uh majorly consisting of the proteins, which I already mentioned earlier. I think that mostly around 70 to 75% of our diet should consist of proteins. Okay, because why? Because they're the bodybuilding foods and they are mostly responsible for strengthening or boosting our immune system. Now, particularly they will be useful or beneficial when we are talking about children and adolescents. Why? Because they are growing. Okay, they are still in the growing period, their height will increase, their weight will increase. Okay, they are, and the adolescence means they're entering the puberty, so all their sex hormones will be activated now. So for that they need more and more of the bodybuilding foods. Okay, now finally coming to the balanced diet, which I'm talking about since the beginning of the session. So balanced diet, see the definition they have given over here is containing adequate amount of all the nutrients required by the body to grow, remain healthy and be disease free. So that is the important part. Adequate amount of all the nutrients means whatever macronutrients we are talking about means carbohydrates, proteins and fats, and whatever micronutrients that we have means the vitamins and minerals. Everything we should be having in proper amount or in adequate amount. Now who will how will we know what is the adequate amount? Okay, that will again vary from person to person, depending on the age, depending on any particular health condition, whether I'm having any health condition or not. Okay, and also on the on which stage I am in my life. Okay, say for example, if a person is pregnant, if a person is breastfeeding, then obviously her nutritional requirements will be increased. Again, I will be talking about that. Okay, now this is basically a chart showing the ideal balanced diet that a person should follow. Okay, during a particular week. So there are 7 days of the week. So if you look at this chart, you will see that everything is there. There is rice, there is dal, there is roti. Okay, some amount of sweet is also there, smoothie is there, yogurt is there. So these are actually, it's not that as they say na ki it's not some punishment that you are having or you are dealing with when you are having a diet. You can have anything you want, but obviously in moderation. Okay, and that anything is not only biryani or burger or ice cream. Okay, no, not like that. But if you are having a sugar craving, if you are having like you are craving for biryani or pasta or pizza, then you can go for it. We call it as cheat day, as we all know, but only once a week. It's not that 4 days are cheat day and 3 days are your diet day. No, not like that. Okay. So that is the basic concept. Now there are particular foods which we need to avoid, particularly if we want to follow a healthy balanced diet, because it's all about consistency. Okay, it's not that you have followed say for example for 1 week you have strictly followed your diet, and then the next week you forget everything and you start eating all those junk and street foods. Okay, no, it's not like that. You have to be consistent whatever you are following. So balanced diet is something which is lifelong. It's not that okay, I want to lose, say for example, 5 or 10 kgs of weight. I'm following the diet for maybe 2.5 months, and then from the third month again I'm back to my old habit. And not only balanced diet, I would like to say, along with that, proper sleep, adequate amount of water, and adequate amount of physical activity. Okay, and now this physical activity doesn't necessarily mean that while going to work you are just walking from your house to the bus stand or to the rickshaw stand and that is your physical activity. No. Okay, physical activity means moderate amount of physical activity, at least 30 to 40 minutes a day. It can be as simple as walking or jogging, or you can go to the gym, you can do swimming, you can do dancing or yoga or whatever. Okay, but at least 30 to 40 minutes a day, at least 3 to 4 days a week, you should give to your body. Okay, in order to lead a healthy lifestyle or healthy life, disease free life, as they say. Okay, now what are the foods we need to avoid? Red meat is obviously something, beef, pork, okay, mutton, these are all the red meat. So these are something which we need to avoid. Now avoid means not that completely cut off. Okay, you have to completely forget about mutton, forget about pork or beef. No, not like that. But you need to avoid it. Okay, or that means maybe once a month, or at the most twice a month, not more than that. Okay, so why red meat, particularly red meat, not chicken or uh, like only the red meat? Why? Because they are high in fat. The fat content in mutton or pork or beef is much more than chicken. Okay, so that's why you need to avoid the red meat, because the fat that is there, it will, high chances are there that it will go and get deposited in your arteries. Okay, which will lead to cardiovascular problems. That's why those people who are already suffering from high cholesterol or cardiovascular problems, they are strictly like advised not to have any type of red meat. Okay, then refined grains or cereals like maida, okay, bread, okay, the paratha that we make, aloo ka paratha, gobi ka paratha, those are actually not healthy for us. Okay, noodles, if it's atta noodles, then okay, but otherwise it's the same thing, noodles, pasta. Okay, it's the same thing. Trans fat is basically saturated fat. Okay, actually it's much more harmful than saturated fat, because it's kind of mimic the unsaturated fat, but it's nothing but saturated fat. Okay, and trans fat is particularly present in the preserved and packaged foods. Okay, say for example the Maggie that we have, okay, packeted noodles, okay, any kind of packeted poha that we have, oats that we have. We have a idea that oats means healthy, poha means healthy, but if it's packeted, if it's packaged, ready to made, those things are available now in the markets, in Spencers and all. You just need to put some boiled water in it and then it will be ready to have. So those are actually the packaged foods. Okay, so packaged foods are full of preservatives. Okay, because they need to be like the shelf life of the food needs to be increased. So for that, these trans fats are added in higher amounts in those food. Okay, then those, ready-made, chicken salami, chicken sausage, okay, all these things, paratha also are there, aloo paratha and all, ready-made. Okay, so those things are actually frozen food. Okay, all those frozen foods, they are high in trans fat. Okay, so those are something that we need to avoid, because trans fat is always harmful, because mainly because it's unsaturated, mainly because it's saturated fat, because saturated fat means it is having no double bond and it easily gets deposited. Okay, the fatty deposits are more in case of saturated fat or saturated oil, while the unsaturated fat or oil, Unsaturated oil, example, the vegetable oils that we have, okay, the soybean oil, sunflower oil, those are actually good for us rather than the refined oil. Okay, so unsaturated fat usually will be having double bonds, so they will be not getting easily deposited. Fatty deposits will be less, so the unsaturated fats are more preferable than the saturated fats. Basically, the unsaturated fats are the healthy fats that we know of, okay, like the almonds, okay, walnuts, those are the healthy fat sources. Okay, so those we should consume rather than, and we should avoid this trans fat and all. Okay, added sugar means, sweets, cold drinks. Cold drinks is again something very bad. We call it as silent killer. Basically, diabetes is nothing but silent killer. Okay, diabetes or high blood sugar. Now coming to the importance. So importance, I think I already mentioned, meeting the nutritional demands of the body, preventing malnutrition. Now talking about malnutrition, malnutrition can be of two types. Okay, it can be undernutrition, it can be overnutrition. So undernutrition means I am not getting the sufficient amount of nutrition that I require or that I need, isn't it? So that means undernutrition. So undernutrition is mostly seen in children. Because why? Because they are growing, they're in the developing stage. Okay, like say we are adults, isn't it? We have already grown, there's nothing left to grow. Like we will not increase in weight, we do not need to increase in height, isn't it? Everything is done in our case. But the children, they're still growing, so like undernutrition is more like children are more prone to undernutrition. Okay, and what is overnutrition? Overnutrition, we adults are more prone to overnutrition. So overnutrition means I'm having more of nutrition and more of bad nutrition, not good nutrition. Okay, means what? More and more of pizzas, burgers, biryani, street foods. Okay, which will lead to weight gain, isn't it? Because all this street food, this junk food, outside food, they are containing huge amounts of fat, mainly the trans fat, isn't it? So fat is nothing only which will be getting deposited inside our body and responsible for gaining weight, isn't it? So overnutrition is mainly obesity or overweight, which will finally lead to different health issues like diabetes or heart problems. Okay, so these are the two types of malnutrition. So to prevent any of the two types of malnutrition, we need to follow a balanced diet, isn't it? Then obviously to maintain the normal energy level, boost the immune system, prevent any kind of lifestyle disorders or chronic diseases like diabetes, cardiovascular disease. Now, what is lifestyle disorder? Lifestyle disorder means those disorders or those diseases which can easily be prevented or easily be managed if we lead a proper lifestyle. Okay, and lifestyle means, just as I mentioned, not only following a diet but also doing proper exercise, having proper sleep, and having adequate amount of water. Okay, adequate amount of water means at least 3 to 3.5 liters a day. Okay, that is the adequate amount of water that we should have. Okay, so that's it. Moving on to diseases. Now, what is the relationship? This is again a particular, like a very important aspect, particularly uh, uh, talking about the students who are actually pursuing the degrees in nutrition and dietetics. Ki, what will be your role, or what are the important things that you need to study, that you need to know about when we are talking about clinical nutrition? Okay, so clinical nutrition means how, with the help of a proper diet or with the help of proper nutritional management. I will be talking about case studies also, so there will be like more easy for you to understand what I am actually talking about. Okay, so how, with the help of a proper nutrition or a proper diet, you will be able to uh, you know treat a disease, therapeutic diet, like as I already talked about. Okay, now what do you mean by chronic disease? Chronic, the opposite term is acute. So acute means something which is uh, apparently or suddenly something which has occurred to you, and there's a particular treatment or there's a particular cure method that after which that person will be okay, fine, disease free. And chronic means something which is a long term thing. Okay, say for like from bachpan only that person is having that particular problem. maybe till adulthood, or maybe till the day that that person will die, he or she will be having that problem. That means it's something chronic. Okay, now most of the lifestyle disorders that we have, like obesity, which I already talked about, overweight, okay, overweight will only lead to obesity, isn't it? And that will lead to this diabetes, cardiovascular diseases, hypertension, okay, high blood sugar. So these are all basically the chronic diseases and the lifestyle diseases, which can easily be prevented or tackled if we, control our lifestyle. Okay, so according to WHO, chronic diseases account for almost three quarters of all deaths worldwide, and 71% of deaths due to ischemic heart disease. Now, what do you mean by ischemic heart disease, or IHD? Ischemia means low oxygen level at the tissues. Okay, so heart, we all know, it's continuously pumping blood. Okay, pumping blood means it's actually uh, what to say, distributing oxygen to all the parts of the body, and oxygen is something very important, we all know that, isn't it? Now if that level of oxygen is reduced, then obviously it will lead to heart disease, it will lead to problem in our normal physiological systems of the body, isn't it? So that is what is ischemic heart disease. It is again a type of chronic disease or lifestyle disorder. 75% of deaths due to stroke. Stroke is nothing but it occurs in the brain. Okay, means when there is no oxygen reaching your brain, that is what is stroke. Okay, or brain death, we also say. 70% of deaths due to diabetes, which will occur in developing countries. Developing countries means obviously India is the example of a developing country. And usually till date, USA is known as the diabetes capital of the world. But I think very soon India will also be, like I just saw, I think uh, day before yesterday only, I saw in the paper that they have given key how the, the proportion of the person suffering from diabetes is actually increasing. And nowadays what happens, like all of us know that, like we are aware of the news that we see, that most of the people who are dying of heart attack, sudden heart attack, are usually in the group of 40 to 50, isn't it? Now the main reason is improper lifestyle. Okay, stress is something which is a major issue, major point. Stress management is again something very important, and these are actually, all linked with diet. I will talk about gut brain axis in the upcoming slides. So actually whatever you are eating, not only your physical well-being, your mental well-being is also related with that. Okay, there's a connection. So it's very important that we manage our stress levels, we have adequate amount of sleep, because of stress only, many times many people are not being able to properly sleep at the night. And also work pressure is there, isn't it? Work life balance is there, work life imbalance, which will lead to all these kinds of problem. Okay, and also unhealthy lifestyle means, एक तो अच्छा खाना नहीं खा रहा है, हेल्दी खाना नहीं खा रहे, ऊपर से we are having consuming alcohol, cigarettes, smoking, okay, having drugs also in some cases. So these are actually something which are majorly contributing to this, lifestyle disorders. Okay, so moving forward, the slides are changing now. Okay, so nutrition for diabetes. So this is again something I already talked about, diabetic diet. We should focus on the protein part items more. Okay, it can be animal source, it can be plant source. Okay, if the, say for example, if your patient is a vegetarian, then obviously you cannot ask that person to have meat or egg or fish, isn't it? So in that case you need to give the plant sources, like we have legumes, soybean, okay, nuts. These are some good examples. And in case of vegetables also, green leafy vegetables and particularly fruits, like the diabetic persons, they are particularly advised not to have fruit juices. Why? Because the fruit juices that we have, usually there are added sugars, and also most of the fruits are actually starchy fruits, isn't it? Whatever fruit, most of the fruits, like we have musambi, orange, okay, pomegranate, these are all, most of the common apple, most of the common fruits are actually high in starch. So fruit juices are something we actually prescribe not to consume daily or avoid. And obviously the sugar items, and more you should be focusing on the protein food items. Okay, And for cardiovascular disease, the most important thing is sodium restricted diet. Again, something I already talked about. Okay. See, the salt content must be lowered, not only in case of cardiovascular disease, but also for hypertension, which is also a type of chronic disease. Okay. And particularly for cardiovascular disease, because cardiovascular disease means nothing but atherosclerosis, the most common cardiovascular disease that we have, isn't it? So it is nothing but deposition of fatty deposits on the coronary artery of the heart, isn't it? Which will lead to atherosclerosis or heart blockage, and finally AMI, that is acute myocardial infarction, or which we call as heart attack in common terms. So in such cases, such patients, particularly, you should be giving oil-free food, okay, boiled food, mostly boiled food. And even if we use oil, then it should be strictly the unsaturated oils, okay, because those are the healthy unsaturated oils and fats, something I already talked about, okay. Now coming to the next part, that is case studies, okay. I will be answering your questions. Don't worry, and I will be seeing the chat also. Now, in the middle, I can't see, because in that case, the flow will be disrupted. Okay. So, starting with the case studies. So, what do you mean by case study? Just example of when, say, for example, all of you are actually studying about nutrition and dietetics, and in future you will become dietitians and nutritionists, isn't it? So, various people will come as in to to get suggestion from you, to get a diet chart from you. So how you will actually deal with such conditions, okay. So say for example, around 2 to 3 case studies I have talked about here. So there is a person, say Mr. X. He's a 84-year-old male, means elderly person, and he is having chronic obstructive pulmonary disorder, which is abbreviated as COPD. I hope many of you already know what is COPD. It's a chronic disorder of the lungs. Okay, means you will be having difficulty in breathing. It's also known as emphysema, means there is some kind of deposition or blockage in the heart, sorry, in the lungs, as a result of which you are having difficulty in breathing. And also his dietary intake is deteriorating, and as a result of which, obviously, if you are not having proper food, then obviously you will be losing your weight. And that is exactly what has happened with this person. And moreover, he's a elderly person, and we all know that as we grow older, there's a chances of losing weight. So obviously, when that person will come to you, you will encourage him or her to have high energy and high protein foods, isn't it? High energy means carbohydrate content will be more. And then after 3 months, you again see that person and see that that person is improving. The dietary intake is improving, and he is consuming more energy and higher protein foods, which was advised by the dietitian at the previous visit. And then again, you perform the next follow up after another 3 months, and then you see that there's a significant weight gain. Previous weight was 59.8. From that, his weight is now 68.9, means almost 10 kg of weight he has gained over the last 6 months, which is huge, isn't it? So that is how you will go, or you will handle your different cases. Okay, another example I've given of a 29-year-old man, means a young man only. He's suffering from OCD. What is OCD? Obsessive compulsive disorder. It's a psychological condition. It's something very common. Actually, I believe each and every one of us have some kind of OCD. Okay, it depends. Now, when we will call it as psychological disorder, when it's something which is not in our control. Okay, if I am aware, if I can understand, if I can feel ki, okay, this is something which is not normal. Okay, this is something which I'm doing, it's not normal. If I'm aware of that, if I'm being able to understand that, that means I do not need medication, or that means I do not need some doctor. I can tackle it on my own. But when the OCD is exceeding that point, when I'm not being able to recognize it, when I'm not being able to understand it, ki, okay, this is a problem, I'm doing something which is not normal. If I'm not being able to recognize that, then that means I need some help. Okay, then maybe I will need some medication or a counselor. Okay, otherwise like it's my totally my personal opinion that some kind of OCD, some type of OCD, each and every one of us actually have. Okay, so OCD is like, what do you mean by compulsive disorder? Something obsessive and compulsive means something which is your obsession, or which you are doing on a basis of compulsion, means you are feeling a kind of what to say, boundness. You are feeling that you are bound to do that. Okay, like every now and then checking your phone, checking your parts. Okay, every now and then maybe some kind amount of dust maybe there is there in your room, and you are going and removing that dust. These type of things are actually the common OCDs that we have, many people have, or most of us have rather. Okay, and higher levels will be like, say for example, just a person is walking in the street and he is feeling maybe someone is following him or her. Okay, but actually no one is there. That means that's a you know uh, exaggerated or accelerated form of OCD, when that person needs medical help. Okay, and anxiety, obviously I don't need to explain what is anxiety. So such a person who is having both these OCD and anxiety, he's also having a 10-day history of refusing to eat and drink. And since the last 6 weeks, he had only had 500 ml of water, which is very less. I already mentioned the optimum level is 3 to 3.5 liters of water, and only 1 to 2 sandwiches, which is again something very less and also unhealthy. Sandwich is not something very healthy. Okay, like mainly or particularly when you are consuming it every day you are having 1 to 2 sandwich, means you are having a very bad diet. Okay, so such a person is has been admitted to the emergency department, and then maybe you were the dietitian or nutritionist and you are being contacted. Then what you will do initially, you will give oral nutritional supplements, means ORS kind of thing orally. That person needs to take it, and then from day 5, you are giving proper food in a bowl and plate, just as normal persons have. And after that, there is a slow improvement, and he starts drinking plenty of water and plenty of ONS. And then by day 9, there's a rapid increase in the body weight from 47 to 50.8 kg. Next case study that I have given is a 61-year-old, again male person, suffering from progressive dementia. What is dementia? Dementia is memory loss. Okay, like it can be of different types. Alzheimer's is also a type of dementia. So progressive dementia means something which is rapidly progressing. Okay, dementia which is rapidly progressing, and along with that, he also has type 2 diabetes, means insulin resistance. Okay, so he was referred to the dietitian for nutritional assessment and support due to significant weight loss and issues with poor dietary intake. And there was also a significant weight loss. And he tended to ask for sweet or savory snacks. Means basically he was leading a very unhealthy lifestyle. In spite of having type 2 diabetes, he was going for sweet and savory snacks. Okay. So what he will do, he will give a diet which is high in energy and protein, and powder based ONS, that is oral nutritional supplement you can give, and also full fat milk you have given, which will be providing 760 kilocalories of energy and 31 gram of protein per day. And then there was a rapid increase in the body weight, 13.8 kg weight was gained by that person. Dietary intake was also improved, and he was continuing to have high energy and high protein foods and drinks. Okay, so that is how you need to deal with the different case studies. Now coming to the next sector, that is optimal nutrition, or nutrition for optimal performance, which is particularly important for the athletes. Okay, the slides are changing, right? No problem. Please someone confirm. Okay, I hope there's no problem. So optimal performance means we are talking about the athlete. So the athletes will always be requiring more amount of energy, isn't it? Why? Because throughout the day, they are obviously much more physically active than us. Us means the normal persons who are leading a normal lifestyle, okay, like the normal office goers or working persons, okay. So compared to us, their normal physical demand, means demand as in energy demand, will also be more, isn't it? So energy demand more means nutritional demand will also be more, their diet will also be different from us. So it will include more of proteins, more of carbohydrates, more of vitamins and minerals, isn't it? And also more of water, because more physical, whenever we are performing any kind of physical activity or physical exercise, we feel thirsty, isn't it? We need to have more and more of water, so hydration is also increased in those persons, athletic persons or sports persons, okay. So what are the key points that the athletes need to consider? Number one, their caloric needs. Obviously they will be needing more calorie. uh Number two, macronutrient amounts and ratios. Protein is to carbohydrate ratios will be more. Meal and snack timings. Now again, timing is something very important. Talking about the balanced diet also, which I already talked about. Balanced diet, not only what you are eating, but the time at which you are eating. That is also very important. Whenever you are going to a dietitian or a nutritionist, if any of you already have experience of going to, you must be knowing that they also tell you the specific timings. You should have your breakfast between this time slot. You should have your lunch between this time slot. Okay, so the ideal time is 7 to 9 a.m. for breakfast, 12 to 1 for, or 11:30 to 1:30 for lunch, and for dinner 8 to 9 p.m. That is the ideal time. Okay, it's not that you are waking up from your sleep at 2 o'clock in the afternoon, then you are having your lunch, and then you are having your dinner maybe 12 p.m. in the 12 a.m. in the night. No, it's not like that. Okay, so the timing is also very important for us also, and obviously for the athletes it will be much more important. And also hydration, something I already talked about. Now talking about the carbohydrate demand or carbohydrate necessity for the athletes. So fuel source is, the main fuel source in our body is carbohydrate, okay. So since these athletes are throughout the day, they are exercising or performing some kind of sport, so obviously the fuel demand or fuel need will also be more, isn't it? So for moderate amounts of intense training, which is defined as 2 to 3 hours per day of intense exercise performed 5 to 6 times per week, the ISSN means, the body of these athletes, nutritional body, suggests consuming 5 to 8 grams per kilogram of body weight, means 8 grams of carbohydrate, and 250 to 1200 gram of carbohydrates per day for athletes who weigh 50 to 150 kg, because they do weightlifting also. Okay, that is for moderate intense training, and for high volume intense training, it's more, 8 to 10 gram per kg, or 400 to 1500 gram of carbohydrates per day. Okay. Now coming to the proteins. Proteins we all know, bodybuilding, so obviously much more important. Even if we, when we go for gymming and normal body training, normal toning of our body, which many of us do in the gyms, for that also we have protein powder, extra nutritional supplements, isn't it? So protein is something very important for the, whenever we are talking about any kind of bodybuilding. Okay, and obviously for the athletes is something indispensable. Okay, so according to the ISSA, that is International Sports Sciences Association, many athletes can safely consume 2 gram of protein per 1 kg of body weight daily, compared with the RDA. RDA is actually the recommended dietary allowance. Okay. Now, what do you mean by RDA? It's different for different types of nutrients. Means what amount of that particular nutrient you actually need to have uh, for getting optimal nutrition. Okay, so that is normally 0.8 gram per kg. But if you are an athlete, you can have 2 gram per kg. Okay, from 0.8, it can be increased to 2 gram. Otherwise, what will happen? You will be having muscle wasting, isn't it? Muscle wasting is something very bad or unexpected if you are an athlete or a sports person. Okay, so again, the amounts will vary if there is moderate amount of training or high volume intense training. Okay, so these are some of the high protein sources, food sources that I have given over here. Peanuts, okay, fatty fish, Greek yogurt, pumpkin seeds, protein powder obviously is there. Cottage cheese is also there. chicken and turkey. Okay, these are actually the high protein sources that you can include in your diet, particularly if you are a sports person. And lastly, coming to fat, again, ISSN recommends athletes consume moderate fat intake, representing around 30% of daily calories. So, 30% of the calories that a particular athlete is consuming can be from the fat sources. However, they can safely consume up to 50% of their daily calories as fat to meet higher volume training needs. So, if you are doing higher volume of intense training, then you can go for 50% of fat source in your calorie intake also. Okay. Uh, Now, coming to the important part, which I already talked about, that is gut brain connection or gut brain axis. Now, what is gut? Gut is the entire digestive tract, can be abbreviated as gut. Okay, means it will include our stomach, our pancreas, our liver, our small intestine, our large intestine. Okay, everything together is the gut. So, whatever food we are consuming, whatever nutrient we are consuming, it's going to the gut from our mouth, isn't it? And brain is the main part of our body. That is something we all know. Because of our brain only, we are actually, like the different centers that we are having inside the brain, particularly the intelligence center, the decision making centers. For that, we are actually humans, isn't it? Our brains are the most developed in comparison to the different other living beings or the animals. Okay, so this gut brain connection or gut brain axis, it's actually a two-way communication which takes place between the gastrointestinal tract and the central nervous system. Central nervous system means it will consist of the brain and the spinal cord. It links the emotional and cognitive centers of the brain with the intestinal functions. Cognitive, as in the different response centers, okay, the walking centers, the balance, talking, okay, these are the cognitive centers. So there's a nice connection which is linking it. Okay. A troubled gastrointestinal tract, means GI tract, can send signals to the brain just as a troubled brain can send signals to the gut. So it's vice versa. Okay. If your food habit is not right, if you are suffering from, say, indigestion or diarrhea or vomiting, that means you are having a troubled GI tract, then that will send signals to the brain. And similarly, if there is a some problem in your brain, then that will also send signal to the gut, just as I discussed in the case study also, isn't it, that the person who was suffering from OCD or anxiety, his food habit was also disturbed, isn't it? He was only having 500 ml of water and only one or two sandwiches a day since the last 6 weeks. 6 weeks means almost 2 months, isn't it? So that means if my mental health is not okay, then my food habits, my eating habit will also not be okay. And vice versa. If my eating habit is not okay, then my mental health will also not be okay. Okay. Now there are some factors which are actually responsible for this you know gut brain axis regulation. So, what are they? Number one, chemicals produced by gut microbes. Now, what do you mean by gut microbes? Gut microbes are actually particularly bacteria. Microorganisms means it can be bacteria, it can be virus, it can be fungus, isn't it? But gut microbes means we are particularly talking about bacteria. Now, there are different, as we know that there are different harmful bacteria also. Similarly, there are different beneficial or useful bacteria also, which we very much require. Okay, and those bacteria are actually present inside our body, particularly in the gut, means in the GI tract. Okay, say for example, we have lactobacilli, okay, we have enterobacilli. So these are actually some useful bacteria which actually help in normal nutrient absorption inside our gut. Okay, and there are some chemicals which are produced by these microbes, and these chemicals will whether these chemicals will be produced or not, that will again depend on what type of food we are having, what type of diet we are following. Okay, say for example, fiber. What is fiber? Dietary fiber is something very healthy also, and something very recommended, particularly to those persons who are diabetic or those persons who are trying to lose weight, who are overweight or obese. Okay, because dietary fiber example will be, say, legumes, okay, cabbage, cauliflower, any kind of leafy vegetables, okay, we call shak in Bengali. So these are actually uh, some food items which are coming under dietary fiber, because whenever you are having these kheera, okay, that is also an example of uh, dietary fiber. So whenever we are consuming this type of food items, we have a sensation of what to say, uh, pulling or filling. Like we feel like okay, we are full, no longer to have any more food. Okay, so that is that sensation of filling is good, because in that case what will happen, you will consume less amount of food, but you will feel that you are done. Okay, so it will be useful for you to lose the weight. Okay, so these dietary fibers are actually also like fermented by this gut bacteria, and they can produce different metabolites which are called short chain fatty acids, like propionate is there, acetate is there. Okay, so basically they have the power to cross the blood brain barrier. I hope you know what is blood brain barrier. There's a particular barrier between our brain and our circulatory system, and that barrier actually prevents some particle, or stops some particle from entering our brain, because that can be toxic to our brain or to our CNS, central nervous system. So these can actually these fatty acids which are produced by these gut microbes, they can actually cross the blood brain barrier, which can in turn impact the functioning of the brain. And there is also something called inflammation, which is an imbalance in the gut bacteria. Means if this amount, or the the sufficient what to say, contribution of the gut bacteria that we require, if that is not there, then in that case it will lead to inflammation, which is known as dysbiosis. So basically it causes the blood brain barrier to be permeable, which will also allow the bad bacteria or the harmful bacteria to enter into the bloodstream, and that will lead to inflammation, which usually leads to various autoimmune disorders. Okay, like multiple sclerosis, Alzheimer's, Parkinson's. These are all disorders related to memory and anxiety, and also depressive episodes also. Okay, so that is the the very what to say, thin line connection between the gut and the brain. And also there is the vagus nerve, which is all the one of the biggest nerves in our body, and that is directly connecting our nervous system with the GI tract. And it has been found that there is the development of various gastrointestinal disorders like irritable bowel syndrome. Means irritable bowel syndrome is nothing but indigestion. Okay, which can happen if there is any harmful effect on this particular nerve. And also neurotransmitters, I hope we know what are neurotransmitters. They are responsible for transmission of nerve impulse, okay, via the synapse from one neuron to the next neuron. Neurons are the functional units of the nervous system, so they are again involved in this regulation of different aspects of digestion, besides regulating our mood. Okay, now coming to something called brain boosting diet. So brain boosting diet means which will boost our brain, basically which will help to maintain this healthy gut brain connection. Okay, that will be the brain boosting diet. So the major contributor behind this can be the probiotics. What are probiotics? Something they are nothing but nutritional supplements, you can say. They are actually not medicines. Whenever we are suffering from diarrhea, na, what we do, diarrhea or loose motion or vomiting, we obviously we consult the doctor, and in many cases we don't even consult the doctor. We self medicate, over the counter medicine, OTC we called, isn't it? So we just go and randomly buy medicines from the shops and start popping those pills. Mostly we go for metrogel, isn't it? Metronidazole, it's a kind of antibiotic that is the most commonly used when we have diarrhea or loose motion. Now, what is happening whenever we are having this metronidazole category of antibiotics for any gut problem, particularly loose motion, they are going to kill the bad microbes, isn't it? The bad bacteria which are present in the gut. Now, besides killing the bad bacteria, they will also go and kill the good bacteria. Means the beneficial bacteria that were there, like lactobacillus or enterobacilli. Okay. So as a result, what will happen? Along with the bad bacteria, the good bacteria will also be gone. And that's why what happens in many cases, in many people, they have side effects like constipation. Okay, maybe the loose motion problem is gone, but now you will be suffering from constipation or indigestion like that. Okay, acidity. So that is basically due to the absence of this good bacteria, because they have also been killed by the effect of the antibiotic that you have taken. Okay, so there comes the importance, or there comes the need of probiotics. So these are basically the nutritional supplements that particularly doctors prescribe when we are suffering from this diarrhea or loose motion and we need to take this antibiotics. So they also prescribe this probiotics. So along with the antibiotics we should also take this probiotic, so that if the good bacteria are dying, then they needs to be replenished, isn't it? They needs to be refurbished inside our body. Otherwise we will again suffer from these problems like constipation and acidity. So for that, uh, these probiotics are very important. And there's a link that has been found in a particular research study which was done in 2017 between gut microbiome composition and cognition in our older adults. Individuals with lower proportions of bacteroides, proteobacteria, these are actually all the beneficial or useful bacteria that are present. Okay, so they have a connection not only with the proper digestion or GI tract, but also with learning, memory, etc. There's also a connection with that also. Okay, now coming to the last part, that is additional nutritional requirements which are important in different stages of life, particularly when we are talking about childhood, pregnancy, and old age. Okay, so beginning with childhood or infancy, infants we say till the age of below 12 months or below 1 year, we call children as infants. After that, they are called as children only. Okay, now what is the scene in case of infants, children, as well as adolescents, which I already talked about before? They are growing, they are developing, so they will need more and more of energy. They are always active, isn't it? Children are always active. They are always doing something or the other. They are not like us that sitting at the same place for hours and hours. They're not like that, isn't it? They are always physically active. So they will be requiring more amounts of energy. They will be requiring more amounts of protein because they're developing, they're growing, isn't it? And their BMR will also be increased. What is BMR? BMR stands for basal metabolic rate. So basal metabolic rate is basically the amount of, or the minimum amount of energy that our body requires when we are at complete physical and mental rest. That means when are we at complete physical and mental rest? Only when we are sleeping, isn't it? So during the night or during the daytime also, when we are sleeping, there is a minimum amount of energy that our body requires, isn't it? Even if we are not physically or mentally active, but still our body requires some amount of energy, isn't it? Why? Because we are breathing, isn't it? Oxygen is going to the heart, to the lungs, to the brain. So there's a minimum amount of energy that the body will require to sustain, isn't it? Otherwise we will die only. So that minimum amount of energy is what is known as basal metabolic rate, or BMR. Now that will vary. That will vary from person to person, isn't it? So for example, a sports person will be having more BMR than a normal person. So in case of children also, BMR will be more. So since the BMR is more, there will be increased need for nutrients and energy, isn't it? So say for example, a 4 kg infant will be requiring more than 100 kilocalorie per kg. And between 4 to 6 months, those infants whose weight will be 6 kg will be requiring roughly 82 kilocalories per kg. So energy needs will remain high through the early formative years, as I mentioned. Usually till around 13 to 14 years, energy demand is more in comparison to the adulthood. Okay. So energy requirements decline thereafter under based on weight, height, and physical activity. Okay. So as an energy source, breast milk offers significant advantages over manufactured formula milk. Now, this is something very important when we are talking about the infants, because the infants are usually breastfed, isn't it? The mother is usually feeding the newborn babies. And breastfeeding is something very important or compulsory. Always the doctors suggest breastfeeding, because in many cases there are, maybe due to health issues or other professional hazards, many mothers, they try or they want to avoid breastfeeding, and that is something not recommended. Okay, it's always said that at least 6 months minimum, If 1 to 1.5 years, then that's very good. Otherwise, at least 6 months, all mothers should breastfeed their babies. Okay, because that is very important. Because otherwise, what will happen? You cannot give solid food to your newborn baby, isn't it? So if the lactation or breastfeeding is not possible, then we go for the formula made milk, and that is again something, packaged and packeted preservative add hota hai, or फिर बहुत सारे what to say, additional things are there, which is because it's man made, it's artificial, it's made in the labs. So anything that is artificial can never be compared with something which is natural. Okay. And moreover, in breast milk there's antibodies present which are coming directly from the mother's body, so that is very important for providing immunity also to the newborn. Okay, so that is something very important. And also breastfeeding is associated with reduced risk for obesity, different allergies, hypertension, type 1 diabetes, because if the from birth only, from infancy only, if the child is not getting a proper immune boost, then for lifelong that person will be having a compromised immune system, isn't it? So water requirement will be so these are actually the list of the various components which are present in breast milk. Okay, so maximum will be water, obviously, since it's a liquid. Vitamins, particularly vitamin A, will be present, which is very important for vision. Fat will be around 3 to 5%, very less. Energy, 60 to 70 kilocal. Carbohydrate will mainly be present in the form of lactose. That's why many babies are also intolerant to lactose, isn't it? Lactose intolerance, I will be talking about that. So in such cases, those babies, unfortunately, they can never be fed breast milk because they are allergic to that. Okay, so in that case we need to go for this formula milk only, like Cerelac and all. Okay, mineral content will be 0.2% and protein 0.8 to 0.9. Now coming to nutritional requirement during the later years, means for the elderly people, old people. Okay, so now what is the problem with elderly people? As we age, there is muscle wasting. Okay, so protein content is reduced, and there are different physiological and anatomical problems, isn't it? So that is why the nutritional problems also arise, and accordingly we need to adjust the nutritional requirements. So in order to reduce the risk for age related bone loss and fracture, vitamin D should be increased, isn't it? Say for example, if the adult requires around say 100 IU means international unit per day, then if it's a elderly person, he or she will need 200. Okay, so it's almost double. So that is it. And talking about iron, iron is something very important also, but it's again something which will cause toxicity if it's consumed in more amounts. Okay, so in old age, what happens, particularly talking about women, since they have already undergone menopause, so the decreased loss of iron is not there. Because in menopause, sorry, during menstruation, what happens before menopause, there is bloodshed every month, so some amount of iron goes like gets excreted or lost via that particular bloodshed. Okay, but in postmenopausal women, elderly women, that problem is not there, so iron loss is not there, so iron intake is actually should be reduced when you are old than say for example a middle-aged woman or a reproductively active woman. Reproductively active means a woman who is capable of conceiving or giving birth to a child. Okay, means before menopause, obviously. So these are some of the nutritional interventions, and also there are some kind of problems with the chewing part. Okay, because दांत का प्रॉब्लम होता है. ओके, सो chewing में प्रॉब्लम होता है, so soft diet is usually recommendable. So that is it. And also not only chewing, bowel problem is also there, peristalsis जिसको बोलते हैं, the normal movement of the food through the GI tract, that is also hampered to some extent. So according to that, you need to modify the nutritional requirements or the diet. Lastly, coming to pregnancy. So any person who is pregnant needs nutrients in increased amount, any type of nutrient, okay, not only macronutrient but also micronutrient, okay, protein, carbohydrate, fat, vitamin, mineral, water, everything that person will be requiring in more amounts, okay, when that particular lady is pregnant. Why? Because whatever that person is consuming will also go to the baby, reach the baby via the placenta. Okay, we all know that placenta is the connection between the fetus or between the growing baby and the mother, isn't it? So, whatever the mother is consuming, she needs to divide that food or that nutrient with her baby. That's why the nutritional demand is increased. And it's said, we all know that during pregnancy, women they gain weight, isn't it? And that is something normal, or rather, I should say, that is something important. It's very important that a person gains at least 5 to 6 kgs of weight when that person is pregnant. Okay, because that person needs to provide proper nutrition not only to herself but also to the baby. Okay, so for that, now particular some things like vitamin B12, okay, folic acid, iron, magnesium, zinc, these are some particular things which need to be consumed in much more amounts if required uh, via nutritional supplements also. Okay, so diet is something very important when a particular person is pregnant, and also when a particular person is breastfeeding, okay, because during lactation also, whatever you are eating, that will also go via the breast milk to the baby, isn't it? So that is why it's very important that the mother consumes and follows a healthy diet. And any type of addiction, okay, any type of alcoholism, smoking is strictly prohibited, okay, during the pregnancy period, and also when the mother is feeding the baby. So that is what they have showed over here. A baby weighing less than 2.5 kg has an increased chance of both physical and mental health problems. The ideal weight is 3 kg of a newborn. 2.5 तक ठीक है, और उसके नीचे means either premature baby, or if the baby is normal like 8 to 9 months में ही अगर हुआ है और 2.5 kg के नीचे है weight, then that means it's not a good sign. Okay, physical as well as mental health उसमें hamper हो सकता है. So it's very important that the baby has a healthy weight, and for that the nutrition of the mother is very important. So increased requirements, see everything, just as I mentioned: energy, protein, essential fatty acids, vitamin A, vitamin C, vitamin B complex, calcium, iron, zinc, copper, सब कुछ ज्यादा ज्यादा चाहिए. At least one additional meal per day during the pregnancy, very important. Okay, we usually consume 3 meals a day, as I mentioned already, isn't it? Breakfast, lunch, and dinner. But in case of pregnant women, one additional meal should be there, okay, maybe in the late afternoon or late evening, like that. Okay, and also that person needs to cut down on energy expenditure, okay, because now that person is also carrying another life inside the body. Okay, so maybe the if the woman was maybe working, say for example, from 9 to 5 o'clock, after that lady gets pregnant, at least it should be reduced to 9 to 2 o'clock or 1 o'clock. Okay, it's not always possible, particularly for working ladies, working women, but again, it is something that is desirable. Okay, that's why maternity leave and everything is so much important. Vitamin A rich food khana hai. Okay, and obviously well balanced diet, you should be having everything in moderation. Okay, now lastly, coming to different food allergies, because whenever you are giving, just as I mentioned, whenever you are prescribing some diet to your patient, you need to know in details about the different health conditions of the patient. Okay, and that health condition or medical condition will also include the different uh, food allergies. Okay, and in many cases what happens, बहुत सारे ऐसे allergies होते हैं जिनके बारे में हमको नहीं पता होता है. Okay, like say for example, if you have not eaten prawn, and now say you are like 25 or 26 years old, and now you have gone somewhere and you are given prawn and you start eating that prawn, and maybe you are allergic to that prawn. So if you have never eaten that prawn before in your life, you will never be able to know that whether you are allergic to prawn or not, isn't it? So that is the case. So एक एलर्जी प्रोफाइल होता है, एंटी एलर्जी प्रोफाइल करके टेस्ट होता है, तो उसमें मोरलेस जो कॉमन चीजें होते हैं जिससे एलर्जी होते हैं, there's a list and you can go for the test. So then you will get to know whether you are having, particularly over here we are talking about food allergy. And then we have lactose intolerance, which I already talked about. Key lactose is one of the main types of carbohydrate which is present majorly in milk and any kind of dairy products. So उसमें वो हमको avoid करना होगा. Okay, so lactose free milk, fermented dairy products like yogurt, okay, दही, ये सब खाना होगा. ओके, फिर काऊ मिल्क एलर्जी होता है, तो काऊ मिल्क रिलेटेड जो भी वो है, मेनली काऊ मिल्क में कैसेन और वे होता है, तो वो सब अवॉइड करना होगा. एंड ग्लूटेन इंटॉलरेंस इज समथिंग वेरी रेयर, ना कॉमन नहीं है. ग्लूटेन इज बेसिकली प्रेजेंट इन द बेक्ड फूड्स. ओके, मतलब ब्रेड में होता है ज्यादातर. इट्स नथिंग हार्मफुल, इट्स गुड, इट्स टाइप ऑफ प्रोटीन. बट किसी किसी में एलर्जी होता है, तो उसमें ग्लूटेन अवॉइड करना होगा. मतलब नॉर्मल जो ब्रेड होता है वो नहीं खा पाएंगे, ठीक है. तो ग्लूटेन फ्री ग्रेन्स, ओके, quinoa, corn, millets, ये सब खाना होगा. Chickpeas, like that. So those are the main food allergies that are there. And last but not the least, something I which I want to talk about is personalized or customized diet. Okay, now that is something very important, particularly standing in this era, 2023. So not only diet, this is something which is, I feel like, is also applicable to the medicines, okay, or treatment therapy in particular, because each one of us are actually different from each other. Okay, so our bodies are also different. Maybe we are having the same organs, we are having the same tissues, we are having the same physiology, same biochemistry, same enzymes, but still our bodies are functioning different. So as a result of which we respond to different, like we respond to the same thing in different ways, isn't it? Some of us are more angry, some of us are more introvert, some of us are extrovert, isn't it? Those are the mental properties I'm talking about. Physical properties also differ. That's why maybe two friends have gone and eaten, say, golgappas. One of them will suffer, maybe will suffer from diarrhea, but nothing happens to the other friend, isn't it? It is common, it happens, isn't it? So that will depend on, that is where we differ from each other. Okay, so that is also applicable when we are talking about prescribing a diet, isn't it? Maybe two patients have come to you, both of us are having more or less the same medical histories, more or less the same weight they are having, same height, and they are maybe trying to lose more or less the same amount of weight, or maybe gain more or less the same amount of weight, because many people are underweight also. They go to the dietitians for having a diet to increase the weight, isn't it? That is also something. Underweight is also something very bad, overweight is also something very bad, isn't it? So same diet, if you prescribe, maybe both the persons will not respond to it in the same way. So there is where the concept of personalized or customized diet comes in. Depending on the history, depending on the lifestyle, depending on the mental as well as the physical, structure or get up of the patient, the diet will vary. Okay, so it's very important that you personally give time to each one of your patients when you are a dietitian or nutritionist, and provide personalized or customized diet to your patient. Okay, so I think that's it. Now, if you have any question, please you can ask me. Gluten intolerance, I already mentioned. When you are not actually tolerant to gluten, okay, whenever you are having any food containing gluten, you are getting allergy responses. Okay, any other? Any more questions? Yeah, dietitian after BSc nutrition and dietetics and MSc. Yeah, obviously. But I think, yeah, if there is a BSc in nutrition and dietetics, then obviously you can become a dietitian. Obviously, no doubt. Okay, PCOD diet chart. Something very important. I would like to answer that question. PCOD, what is PCOD? Polycystic ovarian disease. Okay. Or it's also known as PCOS, polycystic ovarian syndrome. So it's a disease where there's a problem in the ovulation. So the normal menstrual cycle is not maintained. So it's more of a lifestyle disorder, you can say, and it can also lead to problems like diabetes and cardiovascular issues. So it's very important that you follow a particular diet chart where the amount of protein is more and amount of carbohydrate and fat is less, more amount of water, and very important, regular physical exercise. Okay, that is the normal lifestyle you should follow if you are suffering from PCOD. Any other question? Type 1 and type 2 diabetes, I already talked about, I think. Type 1 means relative insulin deficiency. Type 1 means absolute insulin deficiency, means your body is not producing insulin. And type 2 is relative insulin deficiency, means your body is producing insulin but it's not being able to function because the receptors are defective. Okay, whenever there's a particular hormone or a protein in our body or an enzyme in our body, it has a specific receptor also. Okay, where that particular protein will go and bind, and then it will be able to perform its function. Now if that receptor is not being able to recognize that protein, then obviously there will be uh, that particular protein, because these hormones, these enzymes, these are nothing but proteins. So if the receptor is not recognizing the protein, then obviously it will not be able to act. The protein will not be able to perform its function, isn't it? Menopause person, as I already mentioned, ki you are having menopause means iron loss is decreased. So mainly iron overdose ना हो जाए वो देखना है, ठीक है। और सप्लीमेंट के बारे में विटामिन डी, कैल्शियम, ये सब देना है। ओके, बिकॉज ऑस्टियोपोरोसिस, ऑस्टियोआर्थराइटिस, ये सब होने का चांसेस ज्यादा हो जाता है। ओके, विच फॉर्मूला फीडिंग इज गुड फॉर बेबीज? आई थिंक मोर और लेस सब सेम ही है। ओके, उतना डिफरेंस नहीं है। तो सेरेलैक तो सबसे कॉमन है, सब देते हैं, सो दैट इज गुड, वेरी गुड। Can diabetic patient consume fruit juice if no sugar is added? Yes, obviously, but हाँ, fruits जो मैं बोला कि maximum most of the fruits are actually having sugar, natural sugar. Okay, so उसमें तो obviously उतना ज्यादा recommended नहीं है। Ma'am, I want to do internship in, shall I go for online? Yeah, online internship is okay. Obviously, it's okay for dietitian and nutrition because practical में तो उतना कुछ होता नहीं है। ओके, ऑब्वियसली अगर केस स्टडीज थोड़ा होता है तो अच्छा होता है, बट आई थिंक केस स्टडीज यू कैन स्टडी ऑनलाइन आल्सो, जस्ट as this example only, this session only I discussed in details about case studies, isn't it? Human physiology, what main areas are most important to know? Okay, human physiology में main areas when you are studying about dietetics will be मेनली फिजियोलॉजी में द नॉर्मल डाइजेस्टिव सिस्टम। ओके, क्या क्या होता है उसमें, इंजेशन, ओके, देन डाइजेशन, देन एब्जॉर्प्शन, एसिमिलेशन, नॉर्मल जो बेसिक्स होता है उतना ही चाहिए, ज्यादा नहीं चाहिए होता है। आर्थराइटिस डाइट, अगेन ऑलरेडी आई मेंशन, विटामिन डी, कैल्शियम, ये सब ज्यादा होना चाहिए। circumstances nutrition student, it's something traditional. Okay, so as a nutritionist, as a dietitian, always you will be prescribing diets to the patients. Calorie count is means what amount of particular calorie you need to consume, and that will again depend on your age, your gender, what kind of lifestyle you are having. Okay, obviously fruit juice is good, but if you are diabetic, you need to keep in count about the sugar content. Okay, ऑनलाइन इंटर्नशिप के बारे में जो लोग पूछ रहे हैं, आई जस्ट वांट टू से कि बहुत सारे अपॉर्चुनिटीज है। ओके, आई थिंक इन लर्न टू अपग्रेड आल्सो यू विल गेट डिफरेंट अपॉर्चुनिटीज online as well as offline. But nutrition and dietitian may I'd like to say ki there's not much difference between online and offline. Okay. Post surgery, obviously, I already mentioned in my slides also ki soft diet or liquid diet. Okay. Because mostly it depends on the type of surgery. Open surgery may usually, you know, soft diet or liquid diet, parenteral nutrition is suggested. Okay. So I think that's it. और कोई question अगर है तो please. Yeah, obviously सिर्फ healthy balanced diet करने से we can lose weight, but also uh, physical exercise, moderate physical exercise, which I already mentioned. Yeah, yeah, absolutely. Whole fruits with low GI, right? Very good. Okay, low GI means low glycemic index. Glycemic index is basically जो मतलब whatever food you are consuming, depending on the spike that food is causing to your blood glucose level, that is the glycemic index of the food. तो जिसका glycemic index कम होगा, लो जीआई मतलब वो अच्छा होगा, क्योंकि वो खाने से ब्लड शुगर लेवल ज्यादा नहीं बढ़ जाएगा, isn't it? So जो भी खाना आप खाओ, अगर उसका लो जीआई होगा, so that means it's good for you. Yeah, obviously certificate तो मिलेगा ही, obviously will get certificate. Obviously calorie count important है, obviously, because again it will depend कितना कैलोरी चाहिए किसको, उसके हिसाब से तुम दोगे डाइट. Career option is again the same question for milk formula. These are some things I've already mentioned. Certificate mil jayega, don't worry, you just contact with the authorities, you will get certificate. Okay, so I think that's it. I will end now. I think there's no other question. Okay, thank you very much.